you're going to a particular restaurant. It's so convenient now that you can pull up the restaurant website and make a decision what you're going to eat before you get there. You know, I always look for things like lettuce wraps and, you know, probably safe stuff, you know, lettuce wraps that I can actually eat my chicken and a little bit of rice and stuff within the lettuce wrap. But you can eat, you can go and you can eat, and you need to learn how to socialize. And your responses to things like that can be, you know, I'm following the rules that my doctor set forth for me.
It's really important. You know, this tends to happen definitely in some of the patients who, let's say, have peer pressure from friends and not family. And it is a big trap. Okay, I can tell you this from the very outset, especially if this other person has had surgery themselves, so they kind of walk the walk and they kind of trying to empower you. Okay, so patients are very different, number one. Second of all, you have to stay true to what you have learned, and your physiology is probably very different. And it's possible that she or this other person in your life that you will meet one day will tell you that I've had this, I've eaten everything, and I smoke a pack, and look at me. I look perfect, no ulcers, and I've lost all the weight I can. We know when you look at the broad studies, picture of hundreds and thousands of patients, that those models don't ultimately fare well. Those who eat everything and they don't keep on track and they don't follow their supplementals and they don't take their proteins, they don't take their vitamins, it eventually will catch us up with them. It does catch you. So stay on task. Okay, so you go out with friends or family, they're eating other things, you choose the better things. If you want to order a margarita and have it later, a sip of it, it's okay. It doesn't have to be exactly how everyone else is doing, but you can definitely do not miss out on these occasions. You will find that psychologically the impact of those are a lot more detrimental. And you start to self-isolate yourself, and go out, have a good time. Yeah, no, you go out.
You go out. You go out, and you live. You know what? What did you have the surgery for? Did you have
to feel better?
You did to feel better and to live life.
Yeah.
And so, just because you had the surgery doesn't mean you can't live life. And you've got the tool, you've got the knowledge, so you've got the power, and you've got that ability to make the informed choices of what you want to eat and what you want to drink. And that's really it. And so exactly like Dr. Yadegar said, live your life. You know, but know what you need to do portion-wise, that kind of stuff. And that's a hard problem, and a lot of people come across that problem where they feel pressure by outside forces to conform to them.
Okay, so she's older, a whole different physiological platform. So you follow what you have learned.
if to a lot of us, and people can throw rocks at me for saying this, but for a lot of us, food is a drug because it gives us comfort.
Yeah.
And you know what? How do we deal with that comfort or that drug when we can't do that drug like we used to? We do, which boils down to how do we cope with that? How do we cope with the loss of the food and the ability to not eat as much as we would like to eat?
And can you personally talk to her by herself and just say, you know, I love you and you've done terrific. It's just this is my own journey.
Because it is your journey. It's a huge journey.
But you know, I mean, you can still go and
Yeah,
eat and
you can go.
But you probably need to take her to her side and just say, it just hurts me because this is my journey.
And
if she doesn't, then you got to choose.
Yeah. Or just picture her like one of those evil mother-in-laws that wants to do and then you can be strong again.
And you know what? You're not going to change how people are going to react. You're probably not going to change how people are going to react to your surgery. But the bottom line is you have control on how to react to do what you know what you need to do.
Just on that note, a word of warning to boyfriends: if you are eating the leftovers of everyone else around you, I have had a few husbands and wives of the patients who've kind of followed that trend, and it's a challenge. You got to be careful as well. So.